Okay, good morning and welcome once again to UN House and a happy International Youth Day to all of you. Mr. Cleviston Hunt, Director of Youth Engagement, the Ministry of Youth, Sports and Community Empowerment. Ms. Tanya Radosvlejevic, Deputy Representative, the UNICEF Office for the Eastern Caribbean. Kenroy Roach, Senior Development Coordination Officer, Strategic Planning and Team Lead, RCO, representing the UN Resident Coordinator. Esteemed panelists, youth advocates and other specially invited guests, members of the media, ladies and gentlemen, good morning. The theme for this year's International Youth Day is Generational Solidarity, Creating a World for All Ages. The objective of International Youth Day 2022 is to amplify the message that action is needed across all generations to achieve the Sustainable Development Goals and to leave no one behind. It will also raise awareness on certain barriers to intergenerational solidarity, notably ageism, which impacts young and old persons while having detrimental effects on society as a whole. The United Nations headquarters advises us that today and this month in general is an opportunity to celebrate youth leadership, amplifying young voices in public life, and raising awareness around the importance of meaningful youth representation and intergenerational collaboration in decision-making spaces around the world. At this time, I invite remarks from Ms. Jayathama Wickremanyaki, who is the UN Secretary General's envoy on youth.
Greetings everyone and happy International Youth Day. My name is Jayatma Wickramanayaka and I am the United Nations Secretary General's envoy on youth. It is an absolute pleasure and a privilege to join young people all over the world to celebrate this important day. Young people make up one of the largest and most interconnected generations of youth ever. But in all corners of the world, young people also face enormous challenges. The COVID-19 pandemic, the climate crisis, deepening systemic inequalities, and protracted conflicts. As is often the case, the most impacted are also the most marginalized, including young women and girls, LGBTIQ youth, young people with disabilities, youth from indigenous communities, and young refugees, to name just a few. The choices we make or fail to make today will determine whether we break down or break through in response to these challenges we are experiencing. So, as young people continue to act as formidable forces leading the way to halt the climate emergency, as they stand up for peace and justice and against all forms of discrimination, and as they demand their rights and hold decision makers accountable, let us remember that we have more to gain together in solidarity than we do apart. Yet, far too often, still, youth inclusion becomes a tokenistic, ticking the box exercise. This can and this must change. Collectively overcoming inequity and the intergenerational gap in power that prevents young people from meaningfully participating at all levels will be the difference between success and failure. This is especially true when it comes to raising and redefining the ambition of the UN and governments around the world. Sharing a seat at the table and sharing power with young people, especially those left furthest behind, is not about doing youth a favor. It is about fulfilling their fundamental human rights. This is something that is fundamentally at the heart of the UN's own youth strategy, Youth 2030. But while we know that young people have the right to be included in decision making, our political systems continue to remain unfit for this vision. Nearly half of the world's population is under 30. Yet only 2.6% of parliamentarians are under 30. and the age of our political leaders is 62 years. Despite their resilience, young people cannot do it on their own. To support young people's political participation and amplify young voices in public life, today's younger generation needs allies who will help move their words from ambition into action to reach young people regardless of where they are, in villages, in favelas, in refugee camps, cities, or islands, ensuring that no one is left behind. Young people are the experts of their own realities. They are making a difference in public life every day and in every region of the world by tackling issues that matter most to them and demonstrating innovation, resilience, resourcefulness, and leadership. It's simple, really. Youth are powerful advocates and the key for intergenerational collaboration and accountability towards a more just, sustainable, and equal world for all of us. Today and every day, I encourage young people everywhere to continue sharing how you have been making a positive change in your communities. And I'm calling on all stakeholders to take action to support youth leadership and participation. It's about time for young people to be seen and to be heard. Thank you.
We want to thank the UN Secretary General's Envoy on Youth, Ms. Giathama Wakramanyaki, for those very powerful words. At this time, I invite the Deputy Representative for UNICEF Eastern Caribbean Office, Ms. Tanya Rados-Valjavet, to deliver remarks.
Thank you. Director of Youth Engagement, Ministry of Youth, Sports and Community Empowerment, Mr. Cleviston Hunt, the UN Secretary General's Envoy on Youth, Jayathma Vikramanayake, Team Lead at the UN Resident Coordinator's Office for Barbados and the Eastern Caribbean, Mr. Kenroy Roach, distinguished panelists, youth participants, ladies and gentlemen, a very good morning and happy International Youth Day. It is my pleasure to join you virtually this morning for the International Youth Day special focus on mental health in the Eastern Caribbean. And I eagerly look forward to hearing the perspectives of young people as they address the topic. Mental health is a global issue, yet it remains stigmatized and underfunded in almost every country, rich or poor. The situation is no different in our Eastern Caribbean countries. Now, this is extremely troubling for us because poor mental health in childhood and adolescence prevents children from fulfilling their rights and reaching their true potential, which is what we're striving to provide. Reliable data on mental health is not easily available in our sub-region, but according to World Health Organization data, diagnosable mental health conditions affect about 1 in 7, which is 14% of children and adolescents aged 6 to 18 across the globe, and a fifth of adolescents aged 12 to 18 have a mental health condition. Depression alone is on track to be the leading disease burden in the next 10 years. Suicide is claiming the lives of up to 800,000 people every year, one person every 40 seconds. And it's the third leading cause of death among young people aged 15 to 19 years old. Half of all mental health conditions start by 14 years of age, but most cases, while treatable, go undetected and untreated. All of this data reinforces that mental health is a serious matter for us all. In May of this year, 2022, we, UNICEF, used our U-Report platform to gauge young people's perception on their own mental health. The overwhelming majority, 61%, responded somewhat poor, 36% said poor, with only 3% saying average. Now, of concern, none of the over 600 respondents viewed their mental health over the past year as being good or excellent. COVID-19 has certainly put the mental health and well-being of an entire generation at risk, with the potential for long-term poor mental health consequences amongst children, young people, their parents, as well as their caregivers. While mental health concerns are not new, The COVID pandemic has disrupted many of the foundations that assure children's mental health and well-being, and it's also exposed the extent and severity of the global mental health crisis, thus highlighting the need to invest and to act now. School closures and physical distancing measures have reduced children and young people's regular coping mechanisms and contributed towards increased isolation and mental health risks. Furthermore, the social service workforce's access to populations remains challenging, and those in difficult family contexts of violence, neglect, and abuse are cut off from the external support of teachers and their peers and friends. Young people need to be an integral part of the solutions to troubling situation we find ourselves in, and this International Youth Day event is but a small start. We at UNICEF look forward to continuing the dialogue and exploring solutions with all our partners. So I wish you all fruitful deliberations, and thank you.
Many thanks to our Deputy Representative in the UNICEF Eastern Caribbean Office, Ms. Tanya Rados-Flejevic. And as my two colleagues have been giving their remarks, I've been seeing in the corner of my eye a few nods of agreement, which means that we know what the problems are, we have a good idea of what the solutions are, and we just need to get there together. At this time, I invite Mr. Kenroy Roach, the Senior Development Coordination Officer, Strategic Planner, and Team Lead RCO to deliver remarks on behalf of the UN Resident Coordinator. Mr. Roach.
Thank you, Kareem, for the invitation, the introduction. Mr. Cleverston Hunt, Director of Youth Engagement, Ministry of Youth, Sports, and Community Empowerment. My colleague, Tanya Radoslavovich, the Deputy Rep of UNICEF, the Office for the Eastern Caribbean. Esteemed panelists, youth advocates, and other specially invited guests, members of the media, youth representatives, ladies and gentlemen. I must admit that this is one of my favorite UN days to celebrate, the International Youth Day, because it's a day where we examine how to better deploy the creativity and talent of young people to achieve the Sustainable Development Goals. I'm thrilled to join the youth of Barbados and the Eastern Caribbean and youth around the world in celebrating the International Youth Day 2022 under the global theme Intergenerational Solidarity, Creating a World for All Ages. I'm honored to share perspectives on behalf of the UN Resident Coordinator, Didier Trebuch, who I know wanted to be here to share on this very important occasion and actually is on his way back to Barbados and couldn't be here on time. This year's theme is both timely and relevant as we seek to support our member countries to recover from the devastating effects of COVID-19 pandemic, now compounded by the triple crisis of food, energy, and finance. Intergenerational solidarity, dialogue, and partnership is crucial for turning the tide on these crises. When humanity of all ages work together, we all succeed in moving closer to the ideals of the United Nations. That is a world that is peaceful, where human rights are respected and development is sustainable. As we navigate the third year of the COVID-19 pandemic, one area in which we need stronger intergenerational partnership is improving the mental health of our youth. Our research in the UN, as you heard Tanya alluded to, indicates that several countries across the Caribbean are facing a mental health crisis, which needs to be urgently addressed. And youth continue to be disproportionately impacted by crises and shocks, not of their own doing. So now more than ever, preserving youth mental health is imperative. Mental well-being is essential for adolescent health and development. By any measure, young persons have had to navigate 2 years of unprecedented challenges, facing issues ranging from limited social interaction and interrupted schooling to food insecurity and reduced economic benefits. It is therefore not surprising that this has had harmful effects. In fact, a recent study conducted by UNICEF shows that the socioeconomic realities have adversely impacted the daily lives of young people, with 46% reporting having less motivation to do activities they usually enjoy. Mental health issues, including anxiety and depression, are more commonplace among youth, with women and girls disproportionately affected. Something needs to be done, and it needs to be done urgently. So how are we making a difference as the UN? As a sub-regional team, we have become more intentional in moving beyond studies and discussions to more action. We are not only talking the talk, but also seeking to walk the talk. For example, UNICEF is integrating mental health services for adolescents in primary health care, including through school and digital platforms, and providing adolescents, parents, and caregivers with community-based mental health and psychosocial support services. PAHO WHO is also rolling out a plan of action on women, children, and adolescent health and expanding access to quality health care services for mental illnesses. Notwithstanding these and other interventions, we also recognize the need to move the needle more and make a more impactful difference to effectively address the issue of mental health. We need to invest more, break the silence, eradicate the stigma, and promote more open and frank dialogue to increase understanding and appreciation of mental health. So today's intergenerational dialogue is a critical step in this direction. As the UN, we value youth voices, and we have been seeking to provide opportunities for meaningful youth engagement. This approach aligns with the Global Youth Strategy, as you heard, and it envisions a world in which human rights of every young person are realized, that ensures that every young person is empowered to achieve their full potential, and that recognizes young people's agency, resilience, and their positive contributions as agents of change. In this regard, last year we established a youth advisory group comprising 11 outstanding young advocates from Barbados and the Eastern Caribbean, and we're privileged to have Pierre, who is on the panel today, in the room. This group provides guidance to the UN sub-regional team to ensure that our work in the UN is relevant to the needs and priorities of young people across the Eastern Caribbean. We are also mindful that youth are over the talk shops, and so the intention is for today's discussion to evolve into some concrete actions that will rebound to the benefit of youth in our region. In closing, I extend best wishes for healthy and fruitful discussions, and of course, happy International Youth Day to all young persons. I thank you.
Thank you so much, Mr. Kenroy Roach, Senior Development Coordination Officer, Strategic Planner, and Team Lead RCO in the UN Resident Coordinator's Office. I now invite Mr. Cleviston Hunt, Director of Youth Engagement in the Ministry of Youth, Sports, and Community Empowerment, to deliver his remarks.
Morning, everyone. Good morning, everyone. Much better. Just permit me to accept the protocols that has already been established. I know we're pressed for time, so I don't want to take up, more time going into the, all the protocols and so on. And also to say that, it's a pleasure when you come last, because you can strike off a lot of the stuff that you've already written that you were going to say. And there was a lot of stuff that was already said that was very pertinent to this discussion. And I hope that, as we go through the day, that you will reflect on all that has been said, and that you will use that as the platform from which you take off some of the discussions. But it's really a distinct pleasure for me to be here this morning as we discuss this really important and critical point, as your team points out, breaking generational barriers, a discussion on youth mental health. And I'm certain that there will be a very rich discussion that will come out of this discussion this morning. But more importantly, I think what we want, as was said by Mr. Roach, is that there's commitment to action to ensure that we find interventions that will enhance the participation of young people, both here in Barbados and in this region. As usual, the UN is a very happy space for the Ministry of Youth. We have had some very important and critical collaborations over the years that has sought to increase opportunities for participation of young people and to strengthen the youth empowerment agenda. And some of the things that we have done in the past would include the funding of the National Youth Parliament, where we've seen the development of a cohort of passionate and articulate young people. We have some of them in this room this morning. Developing the National Youth Policy, our work with the year report, and also a critical piece which we collaborated with, which would be the Generation Unlimited report. And again, these are the kinds of reports that you can look to see the situational context of Barbadian young people, what are some of the challenges they have faced, and what is the data that you would need to interact with if we are going to improve the conditions of young people in Barbados. And of course, my apologies. I hope I didn't damage this phone, All right, but these things are hard, so. Yeah, but of course, the point I was making is that what we want to do is to pool resources right across the stakeholders in youth so that we can ensure that we can consider all the different sides of problems before we actually choose a path to address the challenges that we find. We are also pleased, and we endorse this workshop in the ministry, and it is significant that it's coming on International Youth Day, which is a day that celebrates young people and gives them a platform for them to tackle the issues affecting them and also to contribute to sustainable development of this region. And all that we have sought to do in our ministry is to provide that platform for young people to develop that, the skills, strengthen the abilities that they have so that they can contribute to their own problem solving. And I want to say the topic that you have chosen for this debate, this discussion, is very apt because it is a derivative of the IYD team, Intergenerational Solidarity, Creating a World for All Ages. And to my mind, this team brings a critical focus on something that is the bedrock of our society: family, kinship relationships, and social relationships. Because these are the things that defines who we are as citizens and residents of any country. And the team also highlights some of the critical concerns that we're having in what I always call the postmodern society of Barbados and really the postmodern societies of the region. So on the one hand, we are recording data that speaks to increase in life expectancy. We know people are living much longer. We are recording data that speaks to the demographic shifts. We're talking about the youth bulge, the fact that, as was pointed out earlier, that young people, under 30 constitute such a significant percent of the populations of the world. And we are also talking about significant changes in family structures and relationships. On the other hand, there are expressed concerns about changing value systems and increases in social problems, such as crime, violence, unemployment, abandonment of the elderly population, and mental illness, among others. And if you listen to what we're seeing in relation to that, you can start to see the tensions that are existing that potentially can create what we're discussing here today, which is the whole mental health challenges that a number of young people face. I was pointed out earlier also to all of these challenges are exacerbated by the COVID-19 pandemic. In fact, our attempts to flatten the curve has resulted in a lot of things. I mean, as was pointed out earlier, the fact that lockdowns and so on, and these things have caused, as we've talked, social exclusion and so on. Again, things that have contributed to mental health challenges. The other challenge, again, in relation to the COVID-19 pandemic is the fact that the gains, all the social gains that young people would have fought for and that we would have established over time have been undermined as a result of that. And if you go back to reports as early as the Eye on Youth, that study that was done by the CARICOM Youth Commission, that spoke as to how we were going to go about addressing the challenges of young people and bringing young people to the forefront, participation, all of those kinds of ideals, that you will see that a lot of that has actually changed and that we've really gone way, way back. And if you look at the findings in the January report, you would have realized that even at the point that that report was being constructed, that young people were under significant pressures and challenges already. So you can understand what has happened, with COVID and what is happening now post-COVID. So I am really saying that there's a need really for us to do some work to actually start to collect some empirical data as to the conditions and the position of young people. If you remember in the Youth Development Index, for those who are aware of that, a document that's put out by the Commonwealth Secretariat, Barbados would have been first in the Caribbean as well as Latin America. And we need now to really investigate to see whether those conditions still exist. So to my mind, what is required at the macro level is for us to achieve a condition of mental illness. Sorry, let me go back a little. To address the situation for mental wellness is what I want. It's for us to return to that place of intergenerational solidarity, where there is consensus and there's collaboration and harmony between all age groups, with the elder generation showing their societal expectations and socio-historical perspectives which they have acquired from the period that they've lived within this society, and for young people to be able now to look and be agents for change, for regeneration, and for continuity of this society. So these are the kinds of tensions that we need to investigate to understand where we are placed and understand also to what is happening with the conditions of young people. Because if young people are not comfortable in this space, in the situation in which they are, then there will be challenges. And I know from my own experiences also too, that you see a lot of challenges to what I call the seasoned youth like myself in relation to, vis-a-vis other young people. And as we said, we work with the Youth Parliament, and every day, there are a number of challenges that you will get come from young people. Because young people, as is expected, are seeking to create this space. And that is fine. All right? What we are saying is that it has to be done in a context of harmony, and a context of consensus, and of shared value systems. All right? And what in the ministry that we are saying is that we need to act decisively and collectively to uplift our young people in our communities. These are some of the steps that we need to take to move our young people towards mental wellness. There was talk about the age discrimination. Young people have to feel as though they have the right to participate in the society in which they are living. So we want to remove this whole question of age discrimination. We want to build and develop synergies with the private and public sectors to support consensus building, intergenerational connectedness among all of our people, and to ensure that we fulfill that duty of care that we have to ensure that none of our citizens or residents are being left behind to languish in poverty and social underdevelopment. And I think these are some of the concerns that we have to address if we are going to protect the mental health of our young people. In the ministry, what we have sought to do is that what we want to look is how we can build resilience in our young people to help them to rebound from internal and external shocks as provided by the COVID activity, the COVID pandemic, and any other shocks that might impact on young people. As was said earlier, young people are generally the most vulnerable population, well, one of the most vulnerable population that we have within our communities, and therefore strengthening coping capacities and so on is very, very going to be very critical. Working with stakeholders to develop policies that widen the choices, the capabilities, and options for people who are already in fragile situations. Creating a generation of young people committed to healthy lifestyles, because that is also very important because, you know, your mental health in a lot of ways is also connected to your physical health. And when I say mental health, I'm trying to make that distinction. I'm lumping all together, but remember, as we have Krista here, there's also that clinical part of the mental health, the depression and so on. But mental health is also if you're not happy, isn't it? And all of that contributes, and it becomes a, you know, revolving cycle that adds to whether you go into depression or not. So I'm going to close because, as I said, I don't want to go on too long. There's a lot, and I know we have an eminent panel here who will be discussing and guiding these discussions. And I believe that these discussions today will start the momentum as we seek to provide solutions to redress the mental health situation of those vulnerable young people among us, and as we seek to build up solidarity and harmony among the generations that will ensure intergenerational solidarity. So I want to thank you for that and hope that you have some very fruitful discussions today, and we will look at what the action plans will be coming out of these. Thank you.
Thank you so much, Mr. Cleviston Hunt, Director of Youth Engagement in the Ministry of Youth, Sports, and Community Empowerment. I was very happy to hear you say that the ministry continues to be very committed to youth wellness because the esteemed panel that we have invited here intends to tell you exactly what you and your colleagues in the ministry can do to assist. Our panelist, Mr. Pierre Cook Jr., is a mental health and human rights advocate in Barbados, the Caribbean, and further afield. He recently completed his Bachelor of Law at the University of the West Indies Cave Hill campus, congrats, and will be pursuing a legal education certificate at the Hugh Wooding Law School before he is called to the bar to practice law in the Caribbean and Commonwealth countries. The work he has done in the Caribbean and the wider world to raise awareness of childhood obesity prevention and NCDs among young people reflects Mr. Cook Jr.'s commitment to agitating for the protection of the rights of young people and other vulnerable groups. Moreover, he has had the pleasure of working with major organizations including the Healthy Caribbean Coalition, NCD Child, the World Health Organization, and the Pan American Health Organization. Mr. Cook Jr. has been invited to speak across the world. His voice and unique perspective have influenced governments and civil society organizations to adopt meaningful youth engagement strategies in various countries and regions, including London, the United Arab Emirates, Geneva, and the Americas. Pierre has served in leadership roles as a representative of the Faculty of Law at the Cave Hill campus and Youth Prime Minister of the Barbados National Youth Parliament. He is currently a youth advisor to the UN team in Barbados and the Eastern Caribbean. Thank you, Mr. Youth Prime Minister. Ms. Chanel Imhoff joins us from Antigua and Barbuda virtually. She is an entrepreneur, communication specialist, and mental health activist committed to serving the people of Antigua and Barbuda, and more specifically the St. Peter constituency in that country. She grew up experiencing the polarizing and divisive nature of politics inspiring her to organize in her community and at some point to run for public office on a progressive platform. Welcome, Ms. Imhoff. May have left the other bios on the ground. Thank you. Has he got the document there? Thank you. Ms. Krista Celine is a practicing and registered clinical psychologist and project management consultant. Krista spends her professional life focused on helping clients who have experienced a range of mental health challenges. She specializes in complex trauma and associated disorders, including mood and personality disorders. Working both locally and regionally, Krista provides support to individuals and companies in the areas of mental wellness and group dynamics. She also serves as chairman of the United Youth Leaders of Barbados. When she is not working, Krista loves beach days and laughing until her face hurts. Her mantra in life is, I do not lose. I either win or learn. Welcome, Krista. And last but by no means least, Mr. David Johnson. Mr. Johnson is a 23-year-old student doctor and mental health advocate. His guiding principle is to be the change you want to see. Recognizing that change is born out of frank conversations and decisive action, David founded Let's Unpack It in January 2020 to empower Caribbean youth to speak up about mental health, challenge stigma wherever it stands, and make mental health a lived reality for all. In the 2 years since its inception, LUI, with David as its president, has established itself as a powerful voice in the Caribbean mental health space and a valuable partner for service organizations, youth organizations, religious groups, and other NGOs. The organization has also worked closely with the Division of Youth Affairs and the UN through the You Report Barbados initiative. Mr. Johnson currently sits on the Healthy Caribbean Youth Mental Health Call to Action Committee, where he adds his voice to the shaping of a soon-to-be-launched mental health strategy targeting numerous stakeholders across the region. Outside of his advocacy work, he is best known for his tenure in the Cadet Corps, where he served as a senior non-commissioned officer and company commander. As a future physician and lifelong advocate, his vision is to provide a high standard of care to his patients and to help shape regional health policy that will expand affordable, equitable access to quality health services in Barbados and across the region. Welcome, Mr. Johnson. At this time, I just want to ask for the help of my colleague, Patrick, in shifting the podium so that we can get down to business. All right, so, yes. All right, so during the opening remarks, we would have heard quite a number of very telling statistics about the state of mental health in our sub-region. We also heard that the collection of data continues to be a bit of a challenge. But at this time, I just want to invite our panelists to give us an idea of the current moment based on where you sit as clinical psychologists, mental health, and youth advocates. Where are we? I'm going to start with Krista, and I'm going to ask her for more of a clinical perspective on this, some of the conditions that we have been seeing over the last few years in relation to youth mental health.
Okay, thank you very much, Kareem. Good morning, everyone. Now, if I talk about mental health within the last couple of years, I have to talk about the pandemic, right? Before we had a challenge, and the pandemic has exacerbated a lot of the challenges. So UE did a UE and your report, actually, the reports came out very soon after one another, and you saw the same thing, depression and anxiety being a challenge. Now let's differentiate the two. There are feelings of depression and feelings of anxiety, which all of us in this room may have experienced at some point. However, for it to be a disorder, we're talking about clinical presentation, we're looking at it happening for a period of time, we're looking at the change in your functioning and specific symptoms. The challenge that we have as mental health professionals is that we're seeing the clinical type show up a little more than usual. And this is now that everything is opening up. In saying that, I also have to say that we've missed quite a lot. One of the major concerns for me personally is that within the school system, we're talking about children, within the school system, teachers are usually the first responders, the first people to spot behavioral challenges, emotional challenges, psychological challenges. We're in an online environment where we're not able to see that, we're not able to respond to that for 3 years. That is concerning. The other challenge that we have, and I know we're going to talk a lot about anxiety and depression, but one of the things that concerns us as well is learning disabilities or learning challenges that young people face. We have a problem where we have young people sitting in a classroom thinking and being told that they're failures, right? Unfortunately, this may be my personal pet peeve, the 11 plus sometimes confirms that in their minds. And so they're going through the school system thinking, I can't get this done, something is wrong with me, but they haven't been tested. And so they're going through a system that is not fit for them. And remember, mental health is not only the depression and anxiety, it's learning challenges as well. It's the attention deficit disorder and things like that. So we are at a place where action needs to be taken. I am a big advocate for getting children tested within the primary school system, and our intervention has to be at the primary school system. We have talks of guidance counselors being at each primary school, but I want to see trained master's level psychologists in the primary school along with social workers. This is a must. We have to be able to respond to children appropriately, and they must have the correct professionals to do that. So that's my quick synopsis of what I'm seeing.
Okay, and just before you go on, specific testing, what specific tests would you like to see in our primary schools, and what types of challenges are we having right now at a later stage, having not been able to diagnose and treat some of those issues early on?
Okay, so when I'm talking about testing, I'm talking about psychological testing. And so to be specific, there are tests like the WISC, and that would detect like dyslexia, things like that. You have tests for ADD and ADHD. It's not an online test, it's an actual almost grueling test that they need to do. And so the professionals that you'd go to would be a clinical psychologist or educational psychologist. They will do a battery of tests, they'll talk to parents, they'll talk to teachers in order to find out where the challenges are, and then be able to help the teachers and the parents respond to those challenges, all right? So if we don't do this, we have children who are not able to learn because the classroom is not conducive to them. We also know there is a link. If you're not getting through in school, you get frustrated. There's also a link with behavioral challenges as well. And we constantly find the link between some behavioral challenges where you dig a little deeper, you're realizing that children are not able to cope within the classroom, along with other challenges at home and things like that.
Understood, thank you. Now let's unpack it, David. The current moment, based on where you sit, what are some of the major challenges affecting youth mental health at this moment?
I definitely think I agree with Krista, what she said about the need being to take action at this moment. I think if we reflect on the statistics that were shared earlier, definitely 1 in 7 young people coping with a mental health challenge or a mental disorder is indeed concerning. And these statistics go back even before the COVID-19 pandemic. And with the COVID-19 pandemic, we've seen a 25% increase in depression and anxiety. And so if you ask me what are the challenges that we're facing, definitely mental health is one of those things. But if we're getting to the root cause of the mental health challenges, one of the chief concerns is that we don't talk about it. I mean, traditionally, we have remained silent. Traditionally, this response has been based in apathy. And so when we don't have these conversations, we tend to give forth the narrative or the idea that we don't care about mental health. And even as we've seen with the COVID-19 pandemic, mental health, much like young people have been traditionally, became one of those boxes just to tick. And so the lack of an emergency plan relative to mental health was also one of the concerns. But to specific challenges that young people are facing, gaslighting, I think that's one of the major concerns facing young people. And as we have this conversation about intergenerational solidarity, I'm not sure there was ever a time where we had that. And so this is something that's, in fact, very aspirational for all of us. It's something that's new. And so when we speak to how we relate to the youth, and if we are indeed concerned about their mental health, then ageism is one of those major issues. In fact, ageism, I would argue, is one of the biggest barriers preventing young people from seeking help. If you're growing up in a household where you're being told that you don't pay bills in this house, so you're not allowed to have an issue, then naturally I'm not going to that person to seek help. And so we must be careful that we do not engage in conversation at a very superficial level and where we say, well, this is the situation, that we do not, in fact, exclude young people from even making contributions, in fact, to changes that they want to see. So definitely circling back to the bigger question of mental health and what is required right now in terms of an action plan, it needs to be comprehensive. I do not want to see that in our response to the challenges that young people are facing, we exclude young people from having these, being invited to the table to offer something to that contribution. So I'm very eager to explore some of these bigger concepts within this discussion, and I'm very happy that we're having this conversation, albeit a little late, given that we are at the tail end of the COVID-19 pandemic. And so, to some extent, damage has been done already. What is imperative now is that we come up with a comprehensive national mental health strategy that not only assists in the event of a pandemic or in the event of a crisis situation, but also when things are good. When things are good, young people are still struggling. And so we need to really put an emphasis on mental health and prioritize it even more in this moment, I would say. Thank you.
Thank you. And recently I would have covered the youth climate action events in March and so on. And one of the slogans was, less talk, more action. And just so that you know, coming out of today's discussion, and we will invite questions and comments from our specially invited guests. We want to draft some proposals, some documents that could assist in informing organizations like UNICEF, the UN, the Ministry of Youth, to better shape the responses to these issues. I'm going to turn it over to Chanel in St. John's, Antigua and Barbuda. Welcome once again. You stand in a very unique position in that you walk the streets of St. Peter in Antigua, and you engage with constituents, youth, at a very different level. What have you been seeing as it relates to their mental health?
Firstly, thank you for having me. It's definitely a pleasure to be here, and these conversations are absolutely necessary in building forward better when it comes to youth and mental health in the region. As my bio would have suggested, I am into politics in Antigua and Barbuda, and I do walk the streets of, St. Peter and the rest of the country. And even before my foray into politics, my passion has always been to raise the standard of care when it comes to mental health in Antigua and Barbuda, and by extension, the region. Young people are struggling. The statistics are off the charts, but in Antigua and Barbuda specifically, we don't really practice proper data collection. And I know this is a problem for a lot of us across the region, but the COVID-19 pandemic has not only exacerbated mental health issues, but it has also put a spotlight on how important it is to address them. So a lot of young people are now understanding what mental health actually is and are taking, one, some are taking more responsibility, and two, some are actually seeking professional help now. But one of the biggest barriers, of course, is access. We conducted a survey last year for World Mental Health Day, following a very successful, discussion similar to this. And what we found was very similar to what was said today. A lot of persons would have graded their mental health as not so good, poor, satisfactory, but not one out of the nearly 300 participants here in Antigua would have graded their mental health as being good. So I think that discussions like these are absolutely necessary, and that by talking about it and removing that stigma and working towards mitigation strategies, as opposed to what do we do after this has happened, is the way to go.
Thank you. And Pierre, your thoughts. Pierre actually was featured in the Sunday Sun of the Nation newspaper. I believe this is not a paid advertisement. It was a very inspiring story about his journey. Your thoughts on the current moment?
I think after hearing the speakers, there isn't much more that I can add, except I do think, and I think we all realize that after the COVID-19 pandemic, there was a gap in access to both physical healthcare services and mental health care services. So you found that young people who usually were out at school or were able to socialize and build a sense of community were removed from that community. And even though we are this e-connected generation, even that wasn't enough to fill the gap. And so during the pandemic, I found that a lot of younger persons had signs or symptoms of what we consider to be depression. They felt a bit more depressed, they were feeling a bit more anxious, especially with the news that kept coming every day, every other week, of some other variant or something else happening. It was stressful. The press conferences, they were stressful. I think there was also an opportunity during the COVID-19 pandemic, because for the first time, I saw on a larger scale, older persons started to speak about their mental health. So you had older persons within the family saying, oh, I can't watch that press conference because it stresses me out. That's not good for my mental health. This is making me a bit anxious to wait and listen to this news. But what we need now is the action. Earlier this year, and testament to what we've been discussing, I was diagnosed with major depressive disorder. And that was shocking for me. I thought I had relatively good mental health. I thought that I was fine. But here it is that after years of trying to mismanage it or trying to deal with it on my own, I finally had the means, financial and otherwise, to step out and seek professional care, help rather, to deal with this. Now, part of the challenge is a lot of young persons don't have that access. Part of the challenge for me was that I did not have that support system at home where I could speak up about what I was feeling or speak to someone about what was going on. What helped was the guidance counselor at school. And so it paints that bigger picture that we need stronger support systems in and around Barbados. Now, we've been having this mental health conversation for a while. What we need to see put in place, what are some of the things that we see young people facing, what are some of the challenges? As much as I want to see a comprehensive plan, included in that plan, we would like to see some measures put in place for access to mental health care services, quality mental health care services. Now, the cost to see a therapist could be around $100, $150 and upwards. The average young person may not have access to those funds to go, whether it's once a week, every 2 weeks, every 3 weeks. If you are diagnosed with a disorder and you need to get medication, the medication is expensive. My medication costs about $200 each time. And so these are the conversations we need to include in this sphere of mental health and wellness and bridging the generational gap. Because beyond desensitization, we have another hill to climb, and that is convincing parents and people across the Caribbean that there's a need for medicinal support for mental health challenges. So they will tell you, okay, I know you're depressed, or I know you're anxious, even take you to see the therapist, but I don't know how I feel about this mad people medication. That is a type of stigma we want to move away from. And so again, I'm happy that this is happening. I was patiently sitting, listening, and waiting. As the RC would tell you, I tend to listen out for the afterwards. What will happen afterwards? What will come after this discussion? And so I'm happy to know that we will be creating some type of policy document to not only put out there, but to guide us as we continue our conversations about mental health, because it can't stop here. It would be remiss of me as a law student not to mention that your health is a human right. You have the right to the highest attainable standard of health. That includes physical as well as mental health. And so more and more and more, we're asking young people and youth advocates to step up and say, you know what, I'm not begging you for this. It is not a privilege for you to give me this. This is my right. I have a right to quality mental health care. And so that is the message we want to take forward so that young persons can understand you're not begging your government to pay attention to your mental health. You're telling them that it is their responsibility to make sure that your well-being is intact. Yeah?
Thank you so much for that. So now I want to delve a bit deeper into those generational barriers, what we consider to be generational barriers. And for me, from a layman's perspective, what generally comes to mind is being young, perhaps just feeling down, expressing it and being told, what do you have to be frustrated about or down about? You don't have any responsibilities, why? But I want you guys to dig a bit deeper into the generational barriers, some of the challenges that we see and hear about in our homes, in our schools, in our churches perhaps, etc. David would have alluded to gaslighting, but what are some of the other barriers, Krista?
Right. So one of the challenges that we have, and I'm going to be speaking, I tend to say I was a youth advocate. I'm aging out. Pierre was part of my youth organization. I see a lot of them. In fact, I know Mr. Hunt, this is as a teenager, I think, along with the UNICEF staff, they've seen me grow up, right? And so my perspective now is twofold. And what I want to focus on is the fact that I know the gentlemen are going to, the other panelists are going to talk about the perspective of youth, but I want to also touch, we cannot talk about young people if we do not talk about the parents and the support system, and that's where I want to start, answer your question from this perspective. Our parents are struggling, and there was a study again out of UE, it's by Dr. Mia Jules, it was in 2020, and they looked, it's Dr. Jules, Professor Maynard, and other health professionals. They looked at indicators of depression and parenting. And what they found, it was not parental monitoring that may have led to the depression, emotional support of parents. That was an indicator, and that says a lot. The gap is not only parents not listening or adults not listening to the needs of young people, it's that they don't know how to. They're not coping properly either. I read this morning in the newspaper about a national parenting program. Our parents are struggling. And we can put the guidance counselors in schools like I want. We can put the support systems. We can do all of that. But we have to address parenting. And this is not crying down parents. This is about empowering parents and saying, parents, you're struggling. You need help. Here is where to go. And so one of the barriers is that we want parents to respond and we want adults to respond, but they themselves have challenges that they need to work on as well. And as we address youth mental health, we need to make sure that they're in a position to listen to young people and to say, because the reality is a 12-year-old who's having issues of depression, I can't see that child. A parent has to give me permission to see that child. And if we grow up in a generation that says, do not tell people your business, the therapist won't know your business, or, going to therapy or doing anything therapeutic or even talking about coping means you're weak. That is a cultural thing, that we're trying to break through. So it's not about only the services, but breaking this mindset that mental health means something is so wrong with you, don't go. That's what we're tackling as well. We need to change that mindset and provide the services as well. And that, for me, is one of the big barriers.
Chanel, sorry. What about you? What does this situation look like in Antigua and Barbuda? I know there are many cultural norms and experiences that we both share, but what would you consider to be some of the major barriers, intergenerational barriers specifically, toward youth mental health in Antigua?
I think that we have very similar situations where, you know, young people who may struggle with feelings of depression, anxiety, or whatever else they're struggling with, they don't have that space, that safe space where they can have somebody who is actively listening to them to help them solve the problem. A few of our secondary schools I know have guidance counselors, and having gone through a guidance counselor and then hearing what I told the guidance counselor the next day, I can understand why some people are reluctant to share, because we don't feel as if we can share with anyone and there's anyone to share with. And, you know, as a panelist before me stated, it's important to include the parents in this conversation, because you have to know how to respond. So we can say, oh, the parents aren't responding, the parents aren't listening, but if they're not equipped with the tools to do so, then what can we realistically expect? So I think what we really need to do is work on providing the resources to those who need it in order for them to properly respond to the issues of youth mental health. Legislatively, which is my main area of focus when it comes to mental health care and treatments and all of that. Legislatively, we have to update our laws to reflect our growing society. Right? I can say for Antigua and Barbuda, the last time we had updated mental health legislation was in 1957. And to see how long that is, both my parents were not even born yet in 1957, right? So that alone shows that we have a long way to go and a lot of work to do. That legislation also focuses on institutionalization, what to do after. We don't have any strategies that deal with mitigation. We don't have anything to deal with destigmatization, deinstitutionalization, and reintegration into society, and even finding resources for persons who have not even gone there yet to maintain good mental health throughout your adolescence. So I think that we have very similar issues, and it's helpful to talk among each other as Caribbean brothers and sisters to see how we are similar, how we are different, what works for you, what works for me, and how we can work together as a region to solve this problem.
Thank you so much. And I'm going to get back to you on the legislative aspect of the youth mental health response in a moment. But I just want to ask David, I know that a lot has been said about the interventions that are needed at the level of the child, especially, as Krista rightfully pointed out, the need also to respond to the needs of parents. But there are many people, again, who have passed that stage already. Youth who have passed that stage have not been able to benefit from those much needed interventions and continue to face generational barriers as, you know, later stage youth, young adults. What are some of those barriers, and what do you consider to be some of the solutions, some of the ways that we can break those down?
I think in some instance, we have what I'd like to call an awareness gap. I think our approaches towards mental health really fall along generational lines. Here it is that you have a very youthful generation now, very convinced in their ways about the impact of many challenges in their lives on their mental health. Here it is that they have a wealth of information at their fingertips and an awareness about what mental health really means, compared to generations before them who did not have this experience, who did not perhaps have the terminology, who did not have the incentive or the access even to mental health care. And so what we have here is this battle. And I feel as though young people are crying out for help. I feel as though we are interested in moving forward. We want policy. We want to break down the barriers of stigma and so on. But we have another generation which is reluctant to do so, albeit that they did not have the level of awareness. And so I think that's where we need to start. I think we need to roll out some kind of education program at a national level, at a regional level, have it on the television, have it online so that it's easily accessible to all age groups. And I think we need to have more frank conversations. I imagine us going out into community centers, into town halls, into our churches even, our places of worship, and having these kind of conversations so that we see mental health is something that is tantamount to your physical health. And it, in fact, impacts your physical health. The data would show us that people who struggle with mental illness or people who struggle with mental health challenges left not addressed will actually have a deterioration in their physical health. And I'd like to draw the comparison as well to our economy. There's a lot of discussion about the economy now. Mental health is a critical part of that. Someone who is going to work all the time and they're struggling with their mental health cannot necessarily be as productive as someone else who does not struggle with certain challenges. So there is an incentive for us to focus on this issue and to find solutions to do so. For young people, particularly who have not had those interventions yet, I agree with Pierre. What we need to do more now is to create more access for these young people. The fact that most of the insurance companies in the Caribbean do not cover mental health. We see a move now to incentivize people to take up health insurance. If we're not going to cover mental health, then again, it just begs the question, do we even care? Or are we still going to allow stigma to thrive? And so I think it's imperative that if we make any kind of recommendations, if out of this conversation we do anything, is to have a holistic approach to health. We no longer need this pocketed approach where we say, okay, well, physical health is here, and then maybe sometime along the line we'll address mental health. And this is based on our interventions in a time of crisis, such as the pandemic, or whether or not it's just on a basic level in terms of our approach to health in general. And so if there is anything I would say, is that a holistic approach to health that has specific emphasis on youth mental health as well in addressing all of these challenges that youth are facing. Yeah.
And for you, Pierre, as a youth prime minister, I expect that you do have some vision, some national vision. What is at stake? There seems to be consensus that many of these approaches have to start at a certain age. They need to include, certain people, certain demographic, parents, etc. But these things require resources, tremendous resources. And David is right. There's quite a lot of discussion about the economic situation that we find ourselves in. So I want you to make a case for diverting some of these very precious resources toward mental health. What is at stake?
I think the government did a brilliant job recently in trying to encourage persons to get the COVID-19 vaccine. They were sharing this message about NCDs, the importance of addressing your health because you don't want to develop an NCD because you could potentially be in a situation where a viral illness comes around, and if you catch it, you're at a greater risk of dying because you have a non-communicable disease. Now, that message was really strong for the last 2 years because right in front of our faces, people were dying, And when you looked at the statistics, for the most part, those persons had an NCD. Now, if we take that same messaging, and I think part of the issue is that we treat mental health kind of like this mythical creature. We can't quite touch it. We know it's there, it's running around somewhere in the forest, but we can't quite grab it, so we don't know how to deal with it. Even though we have all this information. Science keeps changing. All this knowledge we have now, but governments still treat it as an intangible thing that we don't quite yet know how to address. Let's look at the bills. Our highest costs at the Queen Elizabeth Hospital are for treating non-communicable diseases, which includes mental health as well. But that type of narrative isn't put out there in the way to suggest that we need to invest more in mental health services. What I would say, or what I would propose to government, is in the same way that you're talking about, the NIS, and you're talking about the fact that, we may need to take up these payments for individual persons. I'd say as well that you need to focus on your employees, the public workers. If you are not in a great state of mind mentally, and I'm not just talking about feeling good, if you have a mental disorder that is left unaddressed, how can you be a productive worker? And so there's a trickle-down effect in terms of how the economy will bear the brunt of it. If only some economists could make a map or model showing, okay, mental health challenges here, in this year we dealt with it pretty well, or we produced such and such over the next 5 years, but in this year we didn't deal with it that well, and such happened. I think then when we see that our money is being affected, we might see some action. It's unfortunate, but it's the truth. The cultural shift that we were mentioning earlier, the childhood obesity prevention experience provides a great example. Now, one of the things we recognized when we were doing that outlay of the prevention program was that you can get the message to the children, and that's well and fine, but the children are within a school, and you have to speak to their teachers. We can have a national school nutrition policy for the people who are working in the canteens within the schools. But as soon as the children leave the schools, there are those vendors on the outside. You have to have a conversation with those persons as well. When they leave that school environment, they're going home. Mommy and daddy may have a good understanding of what they should and shouldn't eat, but when they go by granny for the weekend, man, come on. We get a little mobby. So we understand in a different way that when we're talking about mental health, all the major players have to be involved. We need sensitization of parents. We need the young people to understand how and where they can support someone else who's going through a challenge. And it is important that I make this point now, that we get it across to our young people that yes, you can support someone else who's going through a mental challenge. You can be there for them, but you are not a professional. So at some point, you need to pass that on or encourage them to see a professional. But until we start taking that whole of society approach, we're going to speak to the parents, we want governments on board, teachers on board, Sunday school teachers on board, only then can we see a shift. Part of the challenge that we find are that those persons who are deeply religious think that the only way that you can treat to mental health illnesses is through prayer. And I don't discount that prayer is a mechanism that you could use to help and assist with mental health challenges, but it must be supplemented with therapy. It must be supplemented, if necessary, with that necessary medication. So prayer, as much as it might grind some teeth, it's not the end-all, be-all in terms of addressing your mental health. In the same way, if you were at home with cancer, you would pray, for the Lord to help you with this. You will also continue to go through chemotherapy. And so that is how we can work with those persons who are seated deeply in their religious beliefs that, God will bring you through. Of course he will. But God has also provided you with physicians, psychiatrists, psychologists who can help you through this journey as well. And so we need to balance our messages so that we don't alienate one person by saying, we want this. Listen to the physicians, take them to therapy, cognitive therapy, full stop. No, let's marry the two. Understanding that there is a line, marry the two for a bit so that both persons can come on board and say, we want to see how best we can do to support our young people. Yeah? Hopefully the government heard and they'll put some plans in place.
Thank you so much for that very comprehensive response. I'm going to throw a similar question to Krista as well, given that she is a clinical psychologist and a professional. What do you envision to be the future society that we will live in, the future societies as a region that we will live in, if some of these issues are not addressed soon?
I don't think we have to look very far. There was a statistic that was saying the suicide rate in Barbados is very concerning. One of the newspapers I was reading, every time I see an announcement of suicide, I get this pit in my stomach because I know that there are tools out there that could help. I know that if there was access, if we were a society that encouraged go seek help for this challenge, that these people could be here right now. And I don't think we have to look at what would happen in the future. I think we just have to look at what's happening now and be able to address it in a meaningful way. Access is one of the big challenges, right? Of course, I could sit and talk from my chair because I am in private practice. However, funding to, and that's why I said guidance counselors have to be psychologists. And sometimes, you know, I get licks for saying this, but our young people deserve the best. Your guidance counselors in schools have to be psychologists, master's level psychologists, and we have to be able to respond financially to have a professional in school. It's not a maybe, it's a need, right? And if we say young people are important, the professionals and the resources must match what we're saying, and right now, unfortunately, they don't. One of the things I also want to mention is we talk about vulnerable populations. We talk about youth, we talk about the LGBT plus community, we talk about persons who are in lower socioeconomic backgrounds, right? We develop programs, but we have NGOs right now on the ground who are gatekeepers for certain communities and are not getting the funding that they need. And we're talking about government funding, yes, we're talking about international agencies, but we want a sustainable response. And I'll give you an example. Through Carrie-Ann Hurley, a social worker, Barbados Family Planning, she runs a young mothers program. Those girls get parenting classes. It's intense. They get group counseling, individual counseling. But Carrie-Ann has to look for funding. You have Jabez House, who is a gatekeeper to a significant population and their families. They also offer counseling, but they also offer the parenting classes, they offer the entrepreneurship classes. We have NGOs, brilliant young people and adults who have the solutions but are fighting for funding. We can't say we are serious about mental health. We have a solution and we have a haphazard approach to how we support these organizations. We have Equals, we have other organizations who are well established, enough to get international funding, but we're not putting our resources there. We want to create something new, or we want to, you understand what I mean? When we talk about access, we have to look at vulnerable populations, who do they go to, and how can we strengthen those organizations? Yes, money, yes, capacity building, but if we're serious about it, these organizations would not have to worry about where money should come from. And so that's, for me, that's one of a pet peeve, but that's where we need to go, looking at how do we look at these vulnerable populations and how do we support organizations already on the ground.
And just briefly, I've gotten a question already from one of our colleagues in the media, and anyone can jump in, Krista, if you want to continue in this vein. The rates of suicide that you alluded to. Obviously, when people are still with us, we can intervene. When suicide becomes a factor, that is a life that we cannot replace, we cannot get back. Based on your various assessments, what are some of the driving factors that are likely to be pushing some of our young people that far, especially over the last few weeks and months?
I want to mention two things, right? One of the things that bothers me, yes, we talk about women and girls, and yes, they are a vulnerable population, but our boys are missing in this discussion. We're in a culture where boys are not allowed, males are not allowed to show particular emotions, right? We are in a generation where, all right, yes, you have issues as a man, but I have so many other issues, right? And it's not one over the other. We're seeing a lot of young males committing suicide. That is a problem. And it's a problem because as a society, we are still not saying, it's okay if you're not okay. Let us see how I can help you. For me, that's a big one. Another one is this idea of hopelessness. We cannot control particular things. Right, we have lots of people who've lost their jobs. When I saw the NIS thing, I had a headache instantly. Like, people are struggling. Everybody in this room at some point has had, within the pandemic, a moment where it's like, oh my goodness, this is tough. But we have persons within a socioeconomic background who we cannot even understand what they're going through. And this idea of hopelessness is crushing. And honestly, what can we do? If you're struggling financially, yes, we can give the services that we can give tangible support, but it's not sustainable. And for many people, that idea of hopelessness is tough. And so it is an all hands on deck approach. I'm tired of mental health being a line item in budgets, a line item on policy, so, you know, a sole mental health policy as well. Mental health strategy, I heard David talking about it. We have to get serious. And it has to be all hands on deck when we see people struggling and be able to say, let me see how I can help. Yes, there's talk therapy, but there's also, okay, let's talk about coping. Lots of young people don't know how to cope. If in schools, I'm talking a lot about schools here, yes. But in schools, if we're teaching young people how to cope every week on Mental Health Monday, and we're drilling it into them as much as we drill everything else, we can see a change, but we have to put our resources where our mouth is, right? And for me, that's going to continue to be a challenge. Mental health can't be a line item anymore. And that's where we need to go. All hands on deck. Churches, community groups, football groups, sporting groups, everybody, all hands on deck. And if we don't do that, we're going to continue this little trend that we're seeing, and we're going to continue to get a pit in our stomach. But you know what I'm most concerned about? When we get desensitized to young people taking their lives. And when I say action needs to be taken now, I'm not saying it as a slogan. I'm saying, good God, please, we need to see some access to young people and get them the access to help that they need.
Any other thoughts on the challenge of suicide?
I do have a quick point to add. I think, and Krista touched on it, so I'll expand on it a bit. Redefining masculinity. We have a Caribbean concept of what it means and what it is to be a man. You know, in terms of providing for the home, this very bravado persona, big and tough. You don't cry. You don't cry in front of your main boys. You don't share this really soft emotions because, you know, girl behavior, you know, you're crying like a girl. So across the Caribbean, we've developed this culture where the identity of being masculine in our society is attached to being a bit emotionless, numbing your emotions. And so when young persons, or young men rather, find themselves in situations where they feel hopeless or they're overcome with certain emotions, who do they go to? They can't go to their boys because we don't talk about that. You know, how do they get their stress out there? The situation in St. Thomas just recently, sad situation. And from hearing the accounts from the persons there, the young man was crying out for help. And so who were the people around him who were able to provide that type of support? And it took courage, and it will always take courage for a young man to stand up and say, yo, I feel so good, boy. I feel a little depressed. I feel a little down. I might need to go see a therapist or something. But we need to create that type of society in Barbados and across the region where young men feel comfortable speaking about their feelings, where young men feel as if I don't have to live up to this very unattainable standard of masculinity in order to be seen as a man in society. That is a conversation that we need to have, and that is a conversation we're not having. Yeah?
I'd just like to add to what the previous panelists would have said, and it's a call to care. I think in some ways we've deferred on that. We see someone struggling and we say, well, there ain't nothing I can do about that, or let me look the other way. And then after a tragic event, we discuss it for 2 days, we see it in the newspaper, and we go back to business as usual. I think in some way we've accepted that there's nothing we can do about the problem, and in some way we have given up our responsibility to address it. And so if you see a young man struggling and you realize he's from a challenged household, he probably doesn't have a positive male role model in that household, he doesn't have caring parents, Why is your response to stand back and do nothing? I think from the responses we've gathered, even in talking with the average Bajan on the street, there's a call to return to that community focus, that idea that the child is raised by the entire community. The idea that I see a young person, it's okay for me to ask them, how are you doing? How is school going? Are you experiencing any challenges? I feel as though we've got to this kind of situation where there's a split between young people and older people, such that even basic conversations don't happen anymore. And I don't know whether it's a situation where you're afraid that there's going to be some level of outburst, but I am advising members of our community to get back to discussing issues, get back to molding young people, to nurturing young people, and showing them a basic level of care. Beyond that, I think what is necessary to address the stigma that is essentially the root of this all is to do exactly what Pierre has said, to allow a level of vulnerability. It is okay to have these kind of conversations. And when we can have these conversations on a friendship level, on a family level, from parent to child, we then open up an avenue for when someone is struggling to say, well, I really, really need your help right now. And from that, we get a natural pathway then to accessing the help seeking that we're talking about. I think, yes, in some instances, young people and people in general are not aware of what are some of the services that are offered. I imagine that if I poll this audience and I ask you what was the suicide hotline number, perhaps no one could tell me. I can't tell you that off the top of my head, and I'm a mental health advocate. That's a horrible situation to be in. I think that if I polled people here and I asked them, do you feel comfortable speaking with your friends and family? We asked Bajans in town the other day this very question. Most of them don't. And so I think what we need now is to really step back and realize that, one, mental health is really a priority for all. Number two, if we are going to make it a lived reality for all, then we need to have these levels of conversations. And by having these conversations, we then give people the access to help. So it's not just about throwing funding, which, yes, we need funding. Right now, global budgets, less than 2% of mental health, less than 2% of health budgets is spent on mental health. That's global statistic. Compare that to the actual statistics of people who are struggling with mental disorders, we see that there's a disconnect between government saying, oh, we care about mental health, and actually putting their money where the mouth is. And so in addition to putting that funding, we also need to work to delegitimize the stigma that exists such that people feel comfortable in accessing the services that are available. Yeah.
Shanu, any thoughts?
Yeah, I agree, most definitely. Funding is extremely important. Dedicating that funding to where it needs to go is even more important. And having strong policies behind of that is even more important, because we have a lot of these panel discussions, we have webinars, we have consultations, and as we would have said earlier, there's not a lot of action that sometimes comes behind that. But as I alluded to earlier, my whole push is a legislative push to ensure that our laws are updated, and it can facilitate ensuring that this funding is, one, made available, and two, designated to where it needs to go in order for mental health to be properly integrated within our general healthcare system. Heard you mention about not knowing the suicide hotline number offhand. I mean, in Antigua and Barbuda, I can say we don't have a suicide hotline. Persons like me have become de facto suicide hotlines. I've been up on the phone at 3 a.m. with young people, especially, talking them off of a ledge because there's really nowhere else to go. The organizations out there that are trying to raise awareness, they don't have the funding that they need to do the things that they need to do. And there is no legislation to back up any of, the many white papers and policies that have come out throughout the years. There's nothing binding the government to that. So all of those things put together, I think, are necessary to push forward.
Thank you. And there are just two more talking points, issues that I want us to just unpack very briefly. One has to do with, and I know we've been speaking about solutions throughout the conversation, but definitely in the interest of being able to kind of map out these solutions and to present them to the necessary stakeholders, I want each of you just very briefly to identify a few of the very immediate steps that you would like to see taken by our perhaps ministries of education and youth, or intergovernmental organizations like UNICEF, UN, our churches perhaps, our teachers. What if you could just map out just a few of those immediate needs off the top of your head, what would they be?
I like that you said off the top of my head, because we'd be here all day. The one I've repeated continuously: master's level psychologists and social workers within the primary school system, along with the secondary school system. The reason is they can diagnose as well, and they have the skills to manage at the school level. Psychological first aid is a need, especially for our teachers, for persons within the workplace. I think that that's very important. I'm thinking in my mind, let's say top 5, right? The other thing I'd want to see is the funding of NGOs who are gatekeepers to vulnerable populations, so organizations, and this is capacity building and financial support. That's like Jabez House, Young Mothers Program that would tackle vulnerable women and their children. We have Equals off the top of my head, but you get the point. The gatekeepers. You and I cannot go into these communities, and we need to be real about that. They're gatekeepers who can do it, and we need to support them in that endeavor as well. I'd like to see greater access for young people, whether, I know there are hotlines, but a mechanism in place for young people to access therapy and counseling. And within the schools, this is UE, BCC, secondary schools, primary schools, a comprehensive program that includes creatives. I think creatives have a seat at this table, and the same way crop over bombarded us and our senses, our message for mental health is always the bad side, quote unquote. We're not looking at what wellness looks like. And teaching coping on TikTok, for example, having our influencers involved in this message of mental wellness and how to cope. I think that that's where messaging needs to be, but our creatives actually have the tools. I know NCF has an art therapy program. If we can scale some of what we have up in a meaningful way within our schools, this is, we could help. And of course, I've said it already, a national parenting program that is, again, in your face, and that we encourage and incentivize parents to come and learn how to cope themselves and how to handle and how to support their children.
David?
I mean, before pointing out my own suggestions, I do want to point to the fact that guidance already exists. The United Nations and through the World Health Organization in particular has rolled out plans for governments to subscribe to. And to date, only 51% of the 194 member states have said that their standards are in agreement with those that were set out by that World Health Organization strategy. So the idea that we have to do something completely novel and we don't know where to start, false. You just need to go look for the guidance and subscribe to it. But in the case of offering my own suggestions, I'd probably promote some kind of 6-point plan. Number 1 would be to educate. I think we need, like Krista is suggesting, not only to put qualified guidance counselors in our schools, but to revamp our HFLE program. I think that's a great place to start. I know for many of the students in here, and I see nodding heads, you go to school, you have about 3 sessions in guidance for your whole school life. And then for the rest of them, you sit down. That's a free period, wasting time. We need to have a strategy, create some kind of manual. It only needs to be 30 pages. And part of that could be a mental health outreach program. You go through these tenets as you go through from 1st all the way up to 5th form, into 6th form, and so on. Very simple mechanism to do that. And we can extend a similar program into our community centers and use our community organizations to push forward this strategy. The second one would be to investigate. There's a dearth of research, especially within this region. In fact, in trying to find statistics to prepare for this panel, I had to go to like the third page to find anything that's relevant for this discussion. I think that in itself is a problem. We need to put more emphasis on that. Number 3 would be to legislate. We've talked a lot about what governments can do. Subscribe to the plan. That's my position on that. The other thing we need to do is to expand that level of access. And I think one of the ways we can do that is to make it more affordable for young people and older people to access, whether that's revisiting, even now that we're having the discussion in Barbados about our NIS program. It's a great time to have a discussion about how we can fund mental health care and access to that level of care. The other thing, of course, is funding. We've already mentioned that in great detail, so I won't speak more to that. But my final point is a curated mental health strategy for emergency situations. We saw what happened in the Bahamas, and we know that there's some people who have not yet been repatriated to their homes. Imagine the mental stress that those people are under. Not only having to be uprooted from their lives and livelihoods, but go into another country to take some kind of refuge and not know where to go next. We've seen it here with the COVID-19 pandemic. And even now, there are a lot of young people in particular who are stuck. We don't know how to move from here. Job opportunities were lost. People are in a situation now who were living an average life and now are below the poverty line. Where do these people go? And so if we're going to speak about any kind of approach to this, it needs to be holistic. It needs to have the health, the holistic health of every average Bajan, every person in the Caribbean at heart, and it needs to include all stakeholders. And it would be remiss of me not to mention, as a representative of the Healthy Caribbean Youth Mental Health Call to Action Committee, we're preparing to roll out a list of calls for all stakeholders across the Caribbean in October. I'm asking everyone who's here, and by extension, all those who are listening, to have a really good look at these calls. They're practical, there are some that are immediate, and there are some that are long-term. And I think that they can guide all stakeholders at the level of government, non-governmental organizations as well, as to where do we need to go in terms of our approach and in terms of our response to the challenges that we're facing, and as well as mitigating future challenges as it relates to mental health.
Thank you. Pierre?
Brilliant. Again, as a student of the law, I'd say to legislate, and I'll tell you why. As I alluded to earlier, your health or access to health care is a human right. In fact, is stated in the Human Rights Instrument that you have the right to the highest attainable standard of health. And so your governments, our governments, have a responsibility to provide that to their citizens. And so whether it's access to medicines, access to actual health care, access to medical procedures, you have a right to these things. So I want to see legislation that speaks specifically to mental health. I don't want us to continue treating it, again, like this mythical being that's running around. We can't quite get a hold of it, so we don't know how to treat it. You know, we don't know how to create legislation around mental health. In fact, we have laws that allude to mental health situations across the Caribbean, but the stigma. I'll give you an example. I was researching some mental health laws in the region. Trinidad actually has a provision within their constitution that if you are a member in parliament, if you are a minister, prime minister even, and you have a mental condition, you could be demitted from office. Now, there's no specificity about what that is supposed to be. So the question is, if I am suffering with depression, does that mean I can't or I won't be fit for office? If I have an anxiety disorder, does that mean I'm not fit for office? And so we need to update our laws so that those situations don't arise, because legally speaking, if you're in office and you have a depressive disorder, you shouldn't be in office. So I want to see legislation around mental health care and the support for mental health. I also want to see, which would support the recommendations made earlier, young people being involved. Young people need to be meaningfully engaged by government, civil society, non-governmental organizations, ministries in a very tangible way. We're tired of the tokenism, and we're tired of the lip service. So we don't just want, you know, Pierre, we're writing these down. I see Kareem is writing away. We're writing these down, and at the end of this, we're going to have a policy paper. And then 2 weeks later, I message Kareem, and I don't have anything. We want to see that beyond this, something is happening. We want to see that action is being put in place because, as we've all alluded to, it is a serious issue. Young persons, young men, young women are facing every single day. And I don't think persons understand to the extent how much students in particular are dealing with this. You have the stress of school, assignments, doing well, living, socializing, all of that just on you, the expectations of your parents. And then you leave into going to a very unsure work environment. We need to take more decisive action. So legislation, for sure, and also the meaningful engagement of young people within those national systems that are looking to treat to the mental health challenges of young people. Yeah.
Thank you. And Chanel, you would have spoken about your passion for legislation and to see those very old laws updated. What would you like to, what does that look like on paper?
So what that looks like is actually something that I would have put together in about 2019 when I was a member of Antigua and Barbados National Youth Parliament, right? That was one of our first legislative agendas where we spoke about upgrading our mental health, a mental health care system. So what updated mental health legislation looks like is the establishment of some sort of national psychological ethics council, bringing all of our mental health professionals together, ensuring that we are all on the same page and properly integrating mental health care with physical health care. I should be able to go to a community clinic for a mental health emergency, not even so much of an emergency, but if I'm having an issue with my mental health, I should be able to have that looked at a community clinic. I should not have to go through a long and laborious intake process, which is what we have now, where I have to go up to the emergency room, where, for starters, in Antigua and Barbados, we do not have a psych ward. So establishing education strategies, ensuring that persons know what exactly mental health is, what mental health disorders are, what to look out for, and educating the persons at the very front. So we have nurses, doctors, teachers, parents, those important stakeholders, mitigate as well. We don't want to wait up until someone has a terrible mental health emergency for us to say, what do we do now? We should start looking at how do we prevent this? How do we give the best care possible so that persons don't get to that level? Investigate. We need to do more research at a local level because although we have a lot of similarities in the region, we still have a lot of differences. So we have to do some investigation and some research. Look at how people view their mental health, why they are not accessing services. If there's no access to services, how can we improve access to those services? And of course, facilitate. We need to ensure that the NGOs and the CSOs who have been working tirelessly to raise awareness are given the funding and the support that they need to do the good work that they are doing. So legislate, educate, mitigate, investigate, facilitate. And I think all of us have summed up those 5 things very expertly in this panel today. And I'm looking forward to seeing what's next.
Thank you so much, Chanel. At this time, I am going to open the floor to any questions, comments, suggestions that you may have. Yeah, feel free to go to the mic.
Hi, good morning, everyone. Just 3 quick points I'd like to touch on. I know at the beginning we would have spoken, Krista, we would have touched on social workers. And it's sad when I think about social workers, I'm not bashing UE or anything, but they only accept around 13 social workers every year. And I was saying this for about 3 years, that social workers are probably soon extinct. When you accept 13 social workers into a university every year, and some will drop out. So when it gets to graduation stage, you have about 6 because some dropped out, some failed. 6 social workers producing every year, we're soon extinct. Thankfully, they have a young one like me who has some more years than me, but they tend to accept mature people as well. There's a very rigorous interview system to get into social work, and I think that that system needs updated. Another thing is they do go into schools to do the HFLE program for the internship for the final year, but again, because they're only about 6, you probably don't see them. I was at the family conflict unit of the police force. And the final point on suicide is the one Pierre touched on, the latest one in St. Thomas. And ironically, I am from Allenview where that occurred. And the day before, I remember there was some drama in the ministry where he threatened not to even come to the debate. And I think back and I wish that Mr. Hunt had told me to rather stay home. I threatened to stay home. I wish he had told me to stay home because that was my friend. And during the parliamentary session, I mentioned Allenview about 3 or 4 times. Only for right after the debate to hear there's a suicide in Allenview. And I say that to say, I wish that we as youth leaders, like myself, can be leaders of the community as well. And not just shine outside the community, but shine in our various communities. And that's why it hurts so hard, because I tend to do most of my work in my community in St. Thomas. I don't only try to shine outside. And to see a young man like that, who was more or less thrown on the wayside because he was pretty normal up to 2 years ago, thrown on the wayside by close persons, friends, family. Oh, he's a madman, leave him alone. Just go down the road like that, especially during a debate where we were speaking so highly of the community, it really hit hard. So I just really wish we remove the stigma and be leaders in our community as well. Thanks.
Any other contributions?
Hello, everyone. Let me just start by saying great presentations from all of you. I have, I guess, a point into a question. We have been talking about, the involvement of parents in youth mental health and, ageism, the intergenerational link, all that stuff. What possibly can we do? Because we always hear, especially from the older persons, sometimes they just don't know, So back in the day, it wasn't depression, but it was just like, I still have to support my family, I'm gonna push through it, and that was my life. So if we're supposed to integrate them into our lives and basically work together to try to improve mental health for everyone, what are some possible ways that we can get through to persons? Because as David would have alluded to, we went into town the other day, and this lady basically said that we have brought on these things on ourselves. When she was back in the day, she did all this stuff, she was fine. Now we have all these problems, we doing all this, all that stuff. So if we're supposed to integrate that generation with us to try to move forward, what are some things or some ways that we can tackle that so that they may not fully understand everything, but at least there's a start in understanding of it exists, it's real, and what are some things that they can do even at home. It may not be as a professional, but still the support that young people need. What are some things that they can do to try to understand what we're going through?
All right, so one of the things that we have to consider, it's not one single event, all right? We have to tackle this issue from all levels. One of the things that I found, especially going through the pandemic, was that churches were engaging psychologists a lot more. I was busy, right? I was like, okay, just give me a little break, please. And so that's a step in the right direction as far as organizations. So we're looking at we have to look at what organizations, what services do our parents tap into, and how can we collaborate with those services and organizations in order to open up the conversation, right? Mental health is one of the most stigmatized conversation. There are no two ways about it. In fact, recently, even with older folk, I did a panel on menopause and looked at there is a mental health link to menopause that nobody talks about because everybody frightened for mental health, right? So finding those organizations that our parents engage with, that's the first step. It's no secret the PTA is not attended the way it should, but how can we incentivize parents? I know we can't make it mandatory, but having these meetings with parents, calling and antagonizing almost, to get our parents to come out and have this discussion is also very important. But there is no one fix, all hands on deck. And that's how our approach has to be with all our services, arming them with the tools that they need in order to talk to the adults and to say, this is how you need to cope and this is how your children need to cope, or how you can help your children cope. That would be my advice.
Yeah. Thank you. Any other thoughts on that point?
I'd basically just reiterate what Krista said. I do think that if we can connect with and reach out to the thought leaders that our parents subscribe to, the pastors, the elders, those community persons who they see as having a certain level of influence, in the same way that we use youth advocates to influence young people, in a ssimilar way, those persons can help influence older persons to understand how to navigate mental health challenges or how to treat two mental health challenges. Within our churches, within our small community groups, Lions and all the other things that the older persons attend and subscribe to, we can try to get the message out there so that they can understand, okay, this not only affects me, but I can see how it would affect someone younger than me or my grandson or my granddaughter. Maybe then we can get that challenge passed. And it's the same conversation we have with food. That's a cultural thing. It's hard for you to tell us not to eat sweet drinks and eat pudding on sauce every Saturday. But when you get that health message out there, when you really tell them the health aspect of it, moderation, you tell them the science bit of it, they tend to understand a bit more and they're more inclined. They may not do away with it altogether, but they're more inclined to take on healthier practices. So in the same way, if you can explain to persons, mental health is such and such and such, and we want you to do such and such and such, they may be more inclined to adhere or listen to some of these recommendations about mental health. So yeah, I think that's a great way to start.
Sorry, Kareem, if I may as well, Pierre made a really important point that we kind of brushed past earlier when he was talking about access to help within the public service. Within private companies, you have something called an employee assistance program, which is mental health support, and you do like your workshops on wellness. Across the board, the workplace is also a good place to start as far encouraging them to have discussions with their employees and invite guests to come to do some creative activities with them, focus on mental health. So just wanted to kind of bring up that again. I think Pierre had said it earlier.
And just to follow on from that, I think the government here in Barbados would have just recently introduced the National Workplace Wellness Policy. So I'm definitely looking forward to seeing what kind of reporting and monitoring will be done there, such that we can kind of assess the level of impact that strategy would hold and probably use it as a model for a national mental health strategy or policy. But speaking to the issue that Chelsea would have raised, I think that's part and parcel of the bigger issue, and that is the divide in terms of between the generations. Suitably so, the theme being intergenerational solidarity, creating a world for all ages. What is paramount, what is of paramount importance here is that we facilitate these kind of conversations. And I think one of the recommendations was to have these kind of intergenerational interventions such that we literally bring a room of people of all ages and we allow them to have a conversation. I think that's something that's missing. There is still this idea or assumption that young people are naive, young people don't know what they're talking about, or they still have a whole life ahead of them, so why listen to them? I think a little nudge, a little force in having these kind of conversations and recognizing that you have the experience, you have the maturity, but perhaps I have a little bit of the awareness. Perhaps I have a little bit of the knowledge and the newer statistics and the models. And if we work together, really what we're talking about, solidarity here, is as the message was played earlier, it's not about doing young people any favors. It's not about us saying, oh, well, that's how you used to live, I'm choosing to go another way. It's not about us saying that what you were doing was necessarily wrong. Perhaps you were doing what was best for you with the best available information to you. What we're saying now is that we have better information. And so let's use some newer strategies and let's work with you to have these kind of conversations that together we make mental health a lived reality for all, thereby making healthier communities, a healthier nation, and a healthier world.
Thank you so much. And in the absence of any other further, yes.
Sorry, but I don't want to keep y'all long.
No problem at all.
I guess y'all can hear me. Sorry about that. I don't wanna. Okay. Just quickly, like how Krista had mentioned the churches. Unfortunately, during COVID, as a Muslim community, we lost a lot of people. I would say over 10, at least 15 individuals were passed away, locally and internationally. But in our community, we don't talk about mental health. It's a very, very taboo topic. It still is, and it's a huge challenge. The Barbados Association of Muslim Ladies would have held a conference a few years ago called Mental Health, Menopause, and Movement. So we would have touched on those 3 M's. From that, we got a lot of conversation, but it stopped there. So I'm trying to, as a Muslim community, we're trying to get out there, but it's still difficult. The imams, as we call it, they don't really conversate about it. We don't really talk about it in schools. We don't really talk about it in the religious classes or anything like that. It's very, very tricky. And that comes from the elder generation where they say, pray. All you do is pray. Yes, praying helps. Yes, our God, we have those, we have so many verses in the Quran that say, like, you know, verily where hardship comes ease and all of that. But what can I do? Because it's very, very tricky waters. I mean, yeah, we come in these forums and, you know, other religious groups have the advantage where they can talk about them and where they can get into church and what's not. But what can I do as a Muslim or as a minority community to break that serious barrier that really needs breaking? Because it's really, really hard. I mean, I know Krista would have seen it with our Muslim community and stuff. I believe all of you would have. So it's a huge challenge, and I just want to know how to move forward with that. Yes.
Yeah. If I may, I think, and it's a very serious point that you've raised, the challenge with religion and, you know, battling religion and your understandings of mental health illnesses. I think more and more young persons, and I said this before, are stepping up to the plate to do things that our leaders should be doing. We saw Greta Thunberg leading the way with the climate crisis. Little Marie in Barbados, again, leading the way with the climate crisis as well. And so what I'm getting at is that in your circle, in your sphere of influence, there are persons that you can have a conversation with, that you can share certain messages with about, you know, why or how they can navigate this or where they can find support. But I do understand there's a greater challenge in reaching out to the larger bodies, so the religious group, and having them to subscribe to the same message. But I think for now, the best I would advise is within those smaller communities, within those groups of friends, within the Barbados Muslim Ladies Association, even within those groups, to continue to have those conversations so that even if they're not getting that access within the structure of their religion, they do have access to that information by and large. And again, it goes back to what we were saying as to why there needs to be a national strategy. Because Muslims, Christians, Baha'is all live in Barbados. If we have a national strategy that says and places this level of importance in mental health, we have policies in place and legislations in place, then that system can support that conversation. So you don't have to depend on UILB coming into your group to give a conversation, or David coming to give a conversation, but there's a national conversation. There's a national strategy to deal with mental health challenges, so that even those persons who may not have access to the devices to see this, even those persons who may not be able to come to these sessions, we can have our persons go out there. We can have our youth commissioners share some of those messages as well, and that national system can help us to really push that message across the Barbados, yeah?
Thank you so much. Now, if there are no more questions or comments, there's one.
Yes, I'll be brief. I just have a few comments.
I agree that we do need the psychologists in the schools, but I think a barrier that we may have is with the parents. I say that because some parents may be embarrassed to have their children diagnosed with certain mental disabilities and disorders, and we can kind of see that in common entrance as well, where they want their children to pass for certain schools, so they can say, well, my child isn't dumb, they went to this school, they passed for that school. They don't want their children diagnosed with certain disabilities because they will say, well, my child is this and that, they're dumb, they have this, you know? I feel like some parents are embarrassed to even have their children in the spotlight like that. And I also wanted to touch on, I think Chelsea may have alluded to it a bit, where some older persons will say that, you know, they did this and they did that back in their day, and they're fine now. But I don't think that they're really and truly fine, because they would have had other issues that they would have had to deal with, like financial issues, maybe even issues in the home and family, where they would have to kind of put their own mental health brushed underneath the rug, where they ignore it. And now they're saying that they're fine, but I really think that they're just so used to ignoring it now that they don't believe that they have a mental issue. I wrote some points down, so I'm just looking at them. I think that some of the older persons of today, they would look at younger children as hard-ears, or, you know, don't listen, and they would just say that they're hard-ears and just give them a slap. When really and truly, I think Crystal would have also mentioned that certain behaviors are linked to mental issues. And I think that that's something that older people ignore, and they kind of just label it as being hard-ears. And just give them a slap, you know, and then you will learn, you will feel to learn. Yeah. So I think that that's also an issue. But I also believe that within the COVID-19 pandemic, it has exposed the mental health awareness that wasn't there before. A lot of older persons, they would like to say, well, you know, nothing wrong with me, I good. But now with COVID, all these cases stressing me out now. Now they're saying, well, you know, they're actually acknowledging now that they have mental issues. And I just wanted to say that, so thank you.
Thank you so much for your contribution. Lots of food for thought and action. At this time, I just want to invite my colleague, Java Seeley, the UN Social Media and Communications Officer, Associate, to deliver the vote of thanks.
Good afternoon, everyone. You here and online, I come to bring what most look forward to, the end. But the beginning of better mental and physical well-being. As Kareem would have introduced me, I am Java Seeley, a young person, but recently a member of the official UN family here at the Resident Coordinator's Office. I now wish to congratulate and thank all the panelists for such insightful discussion. Yes, let's applaud them. Mental health is something that now hits much closer to home for us all. And this discussion brings it right back into our faces in a way that allows us to take specific action towards addressing what can affect our mental wellness in ways that we don't even realize. This discussion was very robust and encouraging. I feel led to begin my own intergenerational dialogue with what I've learned and been reminded of here today. It is now my honor, on behalf of the entire UN sub-regional team here at our multi-country office in Barbados and the Eastern Caribbean, to thank Mr. Cleviston Hunt, Director of Youth Engagement, Ministry of Youth, Sports, and Community Empowerment, for his delivery of remarks. I recognize him being joined by Principal Youth Development Officer, Mrs. Andrea Titus, Ms. Tanya Radosavljevic, Deputy Representative, UNICEF Office of the Eastern Caribbean, for her remarks, Mr. Kenroy Roach, Senior Development Coordination Officer, Strategic Planner and Team Lead, RCO, representing the UN Resident Coordinator, Mr. Didier Tribouc, for the larger global vision of today's International Youth Day. I wish again to thank the esteemed panelists for their excellent observations, analysis, and solutions-oriented commentary and contributions to today's intergenerational dialogue. I wish to thank our audience for being awesome and for being so engaged as well. But seriously, to Krista, David, Chanel, Pierre, and to you, Kareem, thank you for outlining your vision for a world with better health and well-being, and for your passionate contribution, representation, and expression on this International Youth Day. To the members of the media, youth representatives, and other persons joining us online from across the region, ladies and gentlemen, thank you all for making this event what it was today, a success, and a meaningful step at action towards the sustainable development goals that we here are working tirelessly to achieve. Young people have always been a priority for us and will always continue to be. Now, we normally welcome in the beginning, but I now want to welcome you all to keep having the discussion in your own communities, both physically and on platforms like Twitter and Instagram. Feel free and just take it beyond your friends, but also feel free to truly create your own intergenerational dialogues. Talk to your aunts, your uncles, your grandparents, your family friends, your loved ones, because our common wellness is what will help bring us together more meaningfully. To those of you both here and online, special thank you for tuning in, and a special thank you to the combined technical team of UNICT, Merville Lynch Productions, and AccuSounds, who worked quickly to make today's event possible. Thank you to the capable team at Island Caterers, and the biggest thank you goes out to the dedicated members of the UNRCO and the entire UN family for their continued dedication and support in events like these, partnering with us to achieve the SDGs on the road to Agenda 2030. Thank you, everyone. Have an amazing weekend. Happy International Youth Day. Back over to you, Kareem.
Thank you, Java. I think that brings today's event officially to a close, and I just want to wish all of you a happy International Youth Day once again, and to invite you for a light refreshment, a light takeaway refreshment on the outside.